When interpreting an ABG, don't stop after identifying acidosis or alkalosis. The next question is whether the body is compensating appropriately or if there is a mixed acid-base disorder. Start by looking at the pH. If it's below 7.35, the patient has acidemia. If it's above 7.45, they have alkalemia. Next, determine the primary cause. If the bicarbonate is abnormal in the same direction as the pH, it's a metabolic disorder. If the carbon dioxide is abnormal in the opposite direction of the pH, it's a respiratory disorder. Once you have identified the primary problem, check whether compensation is appropriate. Remember, compensation is the body's attempt to bring the pH closer to normal. It never overreacts the pH into the opposite range. In metabolic acidosis, the lungs compensate by lowering PaCO2 through faster breathing. In metabolic alkalosis, they retain CO2 by breathing more slowly. In respiratory acidosis, the kidneys retain bicarbonate, while in respiratory alkalosis, the kidneys excrete bicarbonate. If the compensation is more or less than expected, suspect a mixed acid-base disorder. Another clue is when the pH is almost normal, but both the PaCO2 and bicarb are markedly abnormal, suggesting the two disorders are occurring at the same time. For example, if an ABG shows a pH of 7.24 and a bicarb of 8 and a PaCO2 of 20, the primary problem is metabolic acidosis. You can then use Winter's formula, 1.5 times the bicarb plus 8, plus or minus 2, to calculate the expected PaCO2. If the measured PaCO2 falls within the range, the respiratory compensation is appropriate. If it's higher or lower than expected, there is an additional respiratory disorder. So remember this simple three-step approach. Identify the primary disorder, check whether the compensation is appropriate, or if it isn't, think of a mixed acid-base disorder.